Kia ora, good afternoon. We're breaking into normal programming to bring you the latest on the Level 4 lockdown. We'll take you soon to a news conference at the Beehive where the Prime Minister and the Director General of Health will provide an update on the New Zealand cases. But first, let's take a look at the day's developments. There are 4 new cases of COVID-19 in the Auckland community, all linked to the original case, a 58-year-old man from Devonport. It's been reported the 4 cases are all flatmates. One of them is a fully vaccinated nurse at the Auckland City Hospital. All of the cases are the highly infectious Delta strain. There are 15 locations of interest visited by the original case, a tradesman who also visited at least 7 private homes. The outbreak has sparked a rush on testing centres and panic buying at supermarkets. Well, political editor Tova O'Brien is with us now. And Tova, the Prime Minister indicated more restrictions could be announced today. What sort of things can we expect?
The big one, Mike, is going to be masks. Expect further extension to the mask requirements. So perhaps mandating of masks in places like supermarkets, mandating of masks for essential workers. This is going to be lockdown level 4 on steroids, and masks are going to be a key component to trying to combat that spread of the Delta variant. QR code scanning was another thing that the government has been considering. It's received advice on mandating QR code scanning in certain places, but given that we are in lockdown at the moment, that a lot of the places that the government would be considering putting that mandated QR scanning, that's been put on hold for now. They're dealing with the priorities, and the priority for the government right now is getting people to follow the rules and getting people to wear masks and try and curtail that spread of the Delta variant.
Yeah, and Tova, vaccinations have been put on pause for 48 hours. Is there any chance that could restart sooner?
Yeah, there was kind of much consternation that our greatest defence against COVID-19, the vaccines, that was put on pause because of a lockdown. Why hadn't the government lockdown-proofed our vaccination program? So I think the Prime Minister will focus today on telling us how that vaccination program will get back up and running, saying that most vaccination stations do all have contingency planning in place, but this was a temporary pause, and this is the way, and pointing to the kind of roadmap, if you like, of how those vaccination stations will get back up and running, perhaps looking at some kind of vaccination drive-through. We know that the government has received advice on that from the Ministry of Health, so the Prime Minister will be kind of pointing to how that vaccination program will get back up and running, because the fact that it had shut down is pretty nonsensical.
Tova, 4 new cases overnight, all of them Delta. Does that justify the government's decision to go into a snap lockdown?
Yeah, absolutely. I think with Delta, pull no punches, leave no wriggle room. And the Prime Minister yesterday, the government made the right decision by treating that first community case, that initial community case, as Delta, even though it didn't know it was at that stage. It was just kind of inevitable, really, and it was also common sense, because we know that all of the cases of COVID-19 which have come to New Zealand at the border, all bar one, has tested positive to be the Delta strain. So it was kind of inevitable that Delta would come here, and we know that this is also the way that the government is planning to handle the Delta variant. It is going to go high with those lockdowns and work its way down, because it's seen what happened in places like New South Wales, where they have a soft lockdown and they kind of yo-yo back and forth. There aren't those clear rules. It simply doesn't work, and it usually inevitably ends up in a severe lockdown anyway. So this is the way the government is going to deal with Delta: high, short, sharp, severe level 4 lockdowns.
Well, one of those cases is a nurse at Auckland City Hospital. That must be of huge concern.
Yeah, there are kind of good points and bad points to this. The Prime Minister has pointed to the fact that in hospitals they usually have really strict COVID restrictions. They're good at mapping these things. They have strict PPE use and the like, but bad, of course, as well, because they're full of vulnerable people, elderly people. I think perhaps what's more concerning are these reports as well, the fact that the nurse was double vaccinated. Again, Delta is a nightmare. Vaccinations are not the silver bullet for Delta. They do reduce how infectious the variant is and how sick people get, which is great and why we need to get vaccinated, but they are not the silver bullet. And I think perhaps even more concerning are these reports that the nurse and her sister both went to a nightclub, and that one of the COVID cases also then went on to church. Those high exposure events are a real concern for the public. They are a petri dish for Delta. They are where Delta thrives.
Okay, so from what you're hearing, what's the priority for the government and health officials in this immediate future?
I think especially given the potential for those high exposure events, the church service, nightclubs, bars, those places where Delta thrives, as I say, I think the government's key message today is the need to lock down and lock down properly and for people to follow the rules, because this virus will spread and it will spread like wildfire. We've seen it in Sydney. So that is the number one priority for the government, to really reinforce the need to follow the rules. And then, of course, source identification of the virus, closing the perimeter around the cluster, contact tracing, testing, all of those things that tell us where the virus came from, how long it's been here and where it's been. Those are going to be some of the key focuses for the government. But I think starting with just the basics, New Zealanders follow the rules. We need to shut this thing down.
Tinakwe Tova, and we will be going to the Beehive Theatre very shortly for the Prime Minister and the Director General of Health. Still no sign of them at this stage. Health correspondent Lucy Warhurst joins us now, though, from the Auckland newsroom. And Lucy, what do we know about the 4 new cases announced today?
That's right, Mike. Well, we are just getting early details about them. So what we knew about the man yesterday, he has passed it on to one of his work contacts. That contact has then infected 3 other of his contacts. We understand that they may all live at the same address. So the first man, a tradesperson who visited several homes. So a lot of contact tracing going on to get those people tested. And this is just, you know, how easily the Delta variant can spread, because the person he passed it on to has already passed it to another 3 people. As we know, one of those is a nurse. We understand that they were working on Ward 65 at Auckland City Hospital. I've been speaking to a number of people who have visited friends and family members in Ward 65, very concerned about their risk at this point as well. We understand that one of the 4 could also be a teacher who went to school on Monday. One of the people in question, they're likely to be symptomatic. They're also sort of getting tested. So this is very concerning. Other high exposures, Tova just talking about a potential nightclub, potential school, potential church, all places where Delta is incredibly dangerous.
Lucy, thank you very much for that. We're going to go straight now to the Beehive Theaterette with the Prime Minister and the Director General of Health have just arrived.
Good afternoon. Can I firstly apologise? We never like to be tardy for these 1 p.m. updates, but we literally want to ensure that we're giving people the most up-to-date information that we have available to us.